So what is the process for extracting a broken tooth once you...
Okay, yeah, that's also evolved tremendously. I mean, I think where we started, we were hammering these teeth
that was the last time I thought,
sinus.
They cut a hole in the bone, right? And
yeah, exactly. You make a tree fine through the sinus, and then you'll literally put a round pin on that tooth. Hope you've got the right tooth. Okay.
That's terrifying.
No, that's happened where you actually extract, or you loosen you loosen the adjacent teeth, and then you end up losing 2 teeth. And then you knock this thing out through the mouth. But now, the other thing is,
so many
you can
things
imagine
that can go
this
wrong.
horse's mouth can't open that much. Now you're going to try and get this long, big tooth out of there. It was a nightmare, absolutely. And then you have a massive, big hole straight into the sinus. So what do you? It's yeah, I know. So now we do mostly oral extractions. So what we do is we sedate the horse heavily. We usually have an IV infusion with sedation. So you basically have somebody like almost an anaesthetist to do the sedation.
Is the standing though? It's not
standing in a crash, because obviously we sedate heavily. So you crash the horse and on a headstand. And then we do nerve blocks. So we do a maxillary block around about here. There's the maxillary nerve that runs here, and it runs there. So you block that nerve.
Wonderful to see.
Yeah, with a long needle. Okay, block that for the maxillary teeth. If you want to do mandibular teeth, there's, I don't know if you guys can see it, but the nerve is running inside there.
I can see.
So we'll go with a long needle underneath the jaw, and you block that nerve. And we use long-acting local anesthetic. And then the only problem is if you block the mandibular teeth, you actually also paralyze the tongue. And
so you have to make sure you stay out of
really bite
panic.
their tongues afterward.
Shame.
So again, we can't block both sides, because then you've got a completely paralyzed tongue.
And what do you do? Do you have to tie that?
No, there's nothing you can do. And sometimes horses really chew their tongues after the thing. You can't stop them from doing that. So that's a little bit of a problem. Okay, and then we still use, with normal human dental syringes, we will infiltrate in around the tooth socket as well. So you really,
with local anesthetic.
really deaden that, because if the horse can't feel, it literally just stands there. And you can't work on a horse that's pulling it. So anyway, so then what they do is they use molar spreaders, where we actually go in between the teeth, and you put this, it's like a clamp thing that you go in, and you basically make a little bit of a gap. Because they're tightly packed. Look at this. It's very tightly packed. So you loosen that a little bit, and we always
you must be talking millimeters.
Yeah, it is. And then what we wait a little bit, because then you actually get a bit of hemorrhage in there. So it gives you a little bit of movement. Okay. And then you apply one of those big dental extraction forceps, and they've got a whole range, almost for every different type of tooth.
Really?
There's a different shape extraction forceps.
Okay.
And then we basically attach it to the tooth, and you wrap it with a piece of inner tubing of a bicycle or something, so that, because it's hard to hold on to. And then you have to be very patient, and you slowly start moving it. And
so it's a much more laborious process in a way.
Absolutely.
But
you know what? Taking out a tooth can be anything from half an hour to, we've had these where you can actually see how they curl back in here, to 6 hours, one tooth.
Good grief.
Yes. And then your danger is where you fracture a piece. You actually have to go in, and that's where the oroscope is so handy, where you can then look in, and you've got to get all those pieces out. But now they also have a very other clever way of taking out these teeth, is through a transbuccal approach. So they make, often these diseased teeth are also wedged in. So there's no way you're going to get this tooth out. And then what they do is through the cheek, they make a tiny little incision, and then they drill a screw into that tooth. And then they basically, you just like from outside with a special instrument, you knock out the tooth, but with a screw and the tooth through the cheek. So no more sinus and
opening up.
issues. Yeah, exactly.
Is there one way that's more effective?
No, it depends on the pathology and which tooth.
And you often only know, I suppose,
and I think that's where the expertise come in with specialists who do this a lot.
Okay.
They all learn by trial and error.